My name's Colin. Today we're going to be doing an abdomen supine AP, which is also known as a KUB on our patient Pat. So everything I'm about to show you first, this is before we get our patient into the room. So I already have my exam loaded up. Everything's correct on here as far as the computer screen is concerned. So I'm going to go to my control panel. We're going to select the proper exam. So we're going to be doing abdomen, AP. Our technique is going to be 80 kVp at 10 mass. There we go, and it's already selected on our table bucket, which is perfect. I'm going to head over here, grab our IR detector, because we need this for our pictures. We're going to be doing a T-shot on this patient, so I'm going to put it in lengthwise first. There we go. That's locked in. Just pretend Pat's not here at the moment. So once this is set up, I would go and grab my patient from the waiting room or wherever they're being held at. I would confirm their first name, their last name, check their wristband, ask for their birthday to make sure absolutely this is the right patient I'm doing exams on. Then I would introduce myself before that. And then I would want to make sure they know what they're getting done. So, hey, I'm doing some pictures of your belly today. Why are we doing this? Why did your doctor order this? What brought you into the hospital today? Questions like that to try to get some history from the patient. They might say something like, oh, I've had shortness of breath. And I could ask, okay, how long have you been having that happen? Does anything make it better? Do you take any medications for it or anything? Are you a smoker? Any chance of being pregnant if it's a female? And if it's a female, ask for the last menstrual cycle. And I think that's pretty much everything as far as getting history. Oh, of course, the surgeries, that's a very important one. And once you get all of the information from the patient that you think you need, just repeat it back to the patient so you make sure everything you have is accurate for the radiologist to read through. And once you do that, that's when you would ask your patient to change any clothes other than shoes or socks, anything like that's fine. But clothes have to come off. We'll provide them a patient gown, jewelry, metal, piercings, anything like that, a bra, all of that's got to come off. We'll give them the patient gown. The open end of the patient gown, of course, will be on their backside. Then we would give them privacy or send them to the changing room, preferably. And once they come back, we would have them lie on the table. So now that I have my patient on the table, I'm going to start lining everything up for this exam. So first things first, we're going to line up our tube to our IR. And we're going to be at 40 inches SID to the table bucket. I'm just going to bring this out just a little bit to make sure I'm aligned. And that's about centered right there. Then we'll push our bucket back onto the table. Okay, and then we're going to go back into detent. Just right there. Okay, so these are all aligned now, so I'm not going to be moving those anymore. I'm just going to make sure my collimation's good. We're doing a 14 by 17 lengthwise. And then we're going to be doing a crosswise shot afterwards. So this is when I would tell the patient, hey, I'm going to start feeling on your leg a little bit just to find your trochanter and your pubic symphysis. Patient might not even know what that means, but I'm sure they'll be like, okay. So I'll grab the patient's foot and start wiggling it and feel for the trochanter. I feel it right here, so that means around that area is going to be my pubic symphysis. So about right here, then I'll ask them, okay, I'm just going to kind of press here. Do you need to use the bathroom? Patient will say yes or no. If they say no, I'll just keep on going until I feel hard, which should be about right here, right about there. And Miss Pat is transparent, so I'm going to see if I'm correct. Yeah, about right here is where it's at. So I could actually bring her up just a little bit more to make sure I don't clip that. There we go. Okay. Okay, so now I'm going to grab my marker, make sure I place it on the right spot. She is in the AP position, so my left marker is going on my right side. And Sam showed me this nice trick to fold the clothes to keep the marker flat on the table. So now that I know I'm all lined up, pretty sure the xiphoid's lined up too, I think we're good to shoot. So then we would give the patient the breathing instructions. You would tell them to breathe in, breathe it out, and then hold it out. And as they hold it out, that's when you want to make your shot. I'm just going to make sure my patient is centered. Make sure it looks pretty good to me. Okay, let's go on ahead and do this thing. Okay, Miss Pat, go on ahead and take a deep breath in. Breathe out. Hold it. X-ray. Okay. And then we would have our image show up in here. So this is our image here of our first shot. This is the T shot. It looks like I clipped a little bit on her side there, but we got all of the bones. Alright, so now that we've done the lengthwise part of the T shot, we're going to get ready to do our crosswise, and we're going to create some overlap for this. So first things first, we're going to take our IR out, and we're going to make sure it's in crosswise orientation. There we go, make sure it's still aligned to the tube. Looks perfect. I'm going to take my marker, and I like to put it at the top of the light field. I'll collimate to a 14:17 crosswise image now instead of lengthwise. And what I'm going to do, I'm not moving this or the IR, but we're just going to move Miss Pat down. So about, I think that'll be good right there. Take the marker, put it in the corner of the light field here. Flat so it actually shows up. This is a little, maybe we could ball it up there. That should be good. Okay, so we'll give the patient the same set of breathing instructions, and I'm going to grab the shield tube since we can cover her gonads because it's not in the picture anymore. Okay, Miss Pat, same set of breathing instructions. Go on ahead and take a deep breath in. Breathe out. Hold it. Okay, you can breathe. Let's see our picture come in. There we go. We'll go on. Okay, so we got our diaphragm up to the apices, got our all that good stuff, marker in here. I think we're good. Okay.